Hello, I'm Dr. Friedrich Michaud. I'm a senior consultant in the BioMed-Hospital, a hospital for cancer and hematology diseases. BioMed-Hospital has been specialized in a combination of normal cancer treatments such as operation, chemotherapy, and complementary treatments such as naturopathy, hyperthermie, vitamin, and others. I'm working in this hospital since many years, and BioMed-Hospital exists since about 20 years, performing a combination of this treatment in many cancer patients, about 2,300 patients a year. The BioMed-Hospital is a hospital since about 21 years in the southern part of Germany, combining a treatment in cancer diseases consisting of normal treatments such as chemotherapy and hormone therapy and antibody therapies. But these therapies are being combined with holistic therapies such as enzymes, mistletoe, oxygen, ozone, and also some newer therapies such as hyperthermie locally to several organs or in the peritoneum when there is ascites. And also there are treatments to enhance the quality of life. And by this triple combination, we've been treating many patients since 1989, about 2,400 patients a year. And we've had many surprising outcomes, many surprising therapy results, such as long-time survivors, such as unexpected remissions, by preserving quality of life. In these more than 20 years, many studies have been performed, for example in brain tumors or pancreas carcinoma, which show all in all a good outcome, good therapy results, even sometimes a better therapy results than in normal oncology medicine. The studies we've performed in the last 20 years were done on dozens of patients who have had the normal treatment and did not have success anymore. Looking to the large bowel cancer, for example, metastasizing to liver and lung, normally there's only the possibility to do a chemotherapy, but nowadays you have much more possibilities to treat this disease. For example, together with Avastin, together with hyperthermia locally to the liver, such as enzymes, such as mistletoe, such as oxygen, such as COX-2 blocker. By combining all these mentioned therapies, it is our experience that you have a better outcome in cancer remission and regression by a better quality of life. Now, what are the advantages of complementary and alternative medicine in comparison to normal oncology therapies? The advantages are mainly in preserving quality of life. Normal oncology medicine such as chemotherapy, antibody therapy, or the so-called small molecules have the tendency to have many side effects like diarrhea, like loss of appetite and weight, like pain, like bronchitis. And these side effects do not occur when you do complementary and alternative medicine. The point is whether you will have better or similar results such as in normal oncology medicine. And by studies we have found out that The quality of life is usually much better in therapy in patients who are being treated with complementary medicine. Complementary medicine does not mean that you are excluding meaningful normal therapies such as chemotherapy. On the contrary, we are trying to combine therapies such as chemotherapy or radiation together with complementary therapies such as hyperthermie and other therapies from the complementary medicine. I've mentioned mistletoe, enzymes, vitamin C, selenium, but these therapies are more for preserving quality of life. To get better results in treating cancer diseases, there are other therapies which are not widely known but which can be very effective, such as a redifferentiation therapy with high-dose vitamin D, such as a COX-2 blockage with a steroid or non-steroid arthritis medication, such as meaningful supplements like frankincense, like green tea extract, like other artemisinin and curcumine, very known. By these medication you can achieve quite good results, but you have low side effects. And very important example is treating patients, female and male patients, with anti-hormonal drugs. In anti-hormonal drugs you have many side effects such as aching joints, like depression, like problems, venous problems of the legs. And there's a possibility, for example, to use a supplement which is called indole 3-carbinol instead of a steroid. You have to look to the personal risk of the patient of metastasizing and recurrence to decide to use which medication. But there's also a possibility of predicting therapies, or let's say predicting therapy results, by doing a so-called chemotherapy sensitivities or a supplement sensitivity test, which is being taken from blood.